standard precautions for all patients includes, guys, hand hygiene. That's one of the most important things, guys. Hand hygiene, the use of PPE or personal protective equipment, i.e. gloves, masks, gloves, all of those things, gowns, all of those things are personal protective equipment. Safe injection practices, meaning like after you inject somebody, because sometimes you will have that responsibility of injecting, you know, depending on, you know, your doctor and the responsibility they give you, you know. But most important thing about that, remember, never to recap needles, okay? There should be a sharp's bin or something like that close by. It's a little bin you put your needles in and you just press the lever down and they send it to the bottom, okay? So never ever, that's the last homework question, I believe. Never ever recap needles, guys. Safe handling of potentially contaminated equipment or surfaces of a patient environment. Respiratory hygiene and cough etiquette, meaning when you cough, you know, try not to cough in your hands, cough in your sleeve if you can, like you dab it, like dab on them, dab on them, you know, cough in your sleeve, okay? Standard, go to the next slide. So standard precautions apply to blood, non-intact skin, mucous membranes, contaminated equipment, and all body fluids and secretions except sweat. All right? So these are our standard precautions. Again, guys, like I said earlier about this, please don't recap needles, guys. Put those in the sharp disposal. Wear masks whenever you have to, such as, you know, I don't know if you happen to be coughing or you know somebody's sick, mask up. Wear a gown if there happens to be some kind of contact isolation. Wear your gloves on every patient, every single time. You know, sometimes what we're practicing, it's a bad habit to get into, but some people get in the habit of wearing one glove. You know what I mean? I'm really big on my equilibrium. So whenever I'm working, I feel awkward if I'm like I'm Michael Jackson, I just got one glove. I need to have both of my gloves on, right? So don't get, that's a bad practice that we do in the lab, but definitely always wear both gloves. Okay? Always wear both gloves. And of course, number one thing in standard precaution is washing hands. Remember, standard precaution is also formerly known as universal precaution. I think that just changed recently, actually. Okay? So, guys, let's talk about hand washing. Okay? Hand washing has long been recognized as an effective means of preventing the spread of infection. God, hand washing is so important. So important that, you know, it's one of the main priorities of Harris Health right now is hand washing. Again, like I said, sometimes they have those secret shopper hand watchers, you know, that are watching you wash your hands or using, you know, your alcohol-based rub. So if you can't make it to the sink to get some soap and water, definitely use some alcohol-based rubs. Guys, these are on all the walls everywhere in the hospital. Little white, you don't even have to touch them. They're electronic. You put your hand right there, and it shoots out the little sanitizer. I think there's a maximum number of times you can use these without washing hands is 5 times. Okay? I know that's not in the book, but I'm telling you, max number of times you can use sanitizer without washing hands is 5 times. Guys, I'm not really big on using sanitizer unless like I'm in lab or something. But when I'm in the clinic, I'm washing my hands, soap and water, old school style. You know, please don't use this hand sanitizer, guys, when you're before you go eat, because you know you had that chemical taste. I'm telling you, it happened to me before. I had that chemical taste when I was eating. Okay, guys. So alcohol-based hand rub is the primary mode of hand hygiene in healthcare because it destroys a broad range of pathogens. It's easy to use, and it's less of an irritant on hands. If you're washing your hands 25 times a day, you know, that's an irritant on your hands eventually, and you're gonna, you know, and sanitizer has stuff in it to keep your hands moist, you know. So they also have lotion. If you use hand soap and water, they have lotion at the hospital, little cheap lotion. Make sure you use that lotion, please. Don't use your own lotion. Don't use your own lotion. You're sending lotions and stuff like that because you never know. It can come in contact with a patient and irritate that patient. You don't know everybody's allergies, even though I sponsor Johnson & Johnson. Okay. But however, for visibly soiled hands or when caring for someone with known infectious diarrhea, what's the name of that, guys? C. diff. The CDC recommends washing with soap and water. Guys, I love washing with soap and water. That's the only way I wash hands. You know, I hate using hand sanitizer. Okay. Boom. So on base, guys, on table 12.5, that is our aseptic hand washing technique. Okay. Right there, and we're gonna go over that in 1 second. But you should constantly consider the need for washing your hands throughout the day. Right? After you shake somebody's hand, you know, I might have just washed my hands, and I might have shook somebody's hand. I'm going back to wash my hands again. That's just me. I like to leave the same way I came. Okay, but especially before and after every instance of patient contact. So I always like to bring a patient in the room. Let that patient see me that I'm washing my hands in the sink while I'm talking to them, while they're having a seat. Boom, I'm done. And then if I happen to go drop my patient off, or if that, before I let a patient go, let them see that I'm washing my hands. So clearly, if I'm doing 12 patients a day, that's at least 24 times that I wash my hands that day, right? Right? Before and after. Okay? But let's say I'm taking a patient back to the holding area. Don't forget, I'm going to let somebody see. I'm going to let somebody see that, hey, if I use a sanitizer, I'm like this, hands in the air, just like this. Because you never know, people will snitch on you. People will tell, hey, I didn't see some men washing their hands. That word will be back to the department before you make it back to the office. So be mindful of that. Okay. Also, wash your hands after contact with blood or bodily fluids. Of course, guys. Of course. I don't care if you have gloves on or not. Still wash your hands after blood. I mean, it only makes sense. You don't want to walk around with hands like that. I hope you would never ever go in with no gloves on. That's just be crazy, right? Okay. After contact with suspected infectious material, you know, you always want to wash your hands after invasive procedures such as a biopsy or even an endovaginal exam. That's another reason to have anything invasive, anything inside the body. Okay. After coughing, sneezing, or blowing your nose, you know, again, practice our dad technique. Sneeze into your arm. There we go. Do it. Give my example. Do it. Or blowing your nose. You know. After using the restroom, I mean, that really should go without saying, right? I mean, we all should be, like my little man here, washing our hands after we come out the restroom. But God, you'll be surprised how many people don't wash their hands. I gave you my story, but I give you another story. You know, several stories. You would think that, not to be bagging on my ladies. I love my ladies in here. I love you guys. But the ladies that you do a transvaginal on, those are the main people that don't wash their hands. They'll go, can you go to the restroom for me? Empty your bladder? Sure will. You mind, these walls are so thin, you can hear everything going on. They go in the restroom, you hear the toilet flush, you hear the door open. All the time. All the time they don't wash their hands. And then that's the same person that get up and say, thank you. You know? So be careful with that, okay? And
if somebody raises their hand,
make reports.
I can give you the fist bump, or you know, you don't have to shake people's hands. It's not a requirement that you shake people's hands.
Yeah.
If you're not a handshaker, say I don't shake hands in a nice way.
Interview maybe.
Or you know, dress it up. Let's. I don't want to spread infectious diseases in the hospital, so I don't shake hands.
But I'm going to keep my gloves on.
I wouldn't do that either. I wouldn't shake nobody's hand with gloves on. Some people can take that as disrespect. Depending on the person. Depending on the person. Depending on the person. Just give them that nice smile. Whoever do that. Give them that Uber smile. Okay? Also, of course, guys, before going on lunch or break and leaving for the day, please wash your hands. Okay, guys? Wash your hands. That's the moral of the story, guys, is what?
Wash your hands.
Wash your hands. Guys, I have our, this is actually the table 12.5 on paper version. I'm going to pass this out to you guys because this is yet something else for you to study for tomorrow's test, right?
Mm-hmm.
We're going to go over this worksheet. But it's just hand washing. I mean, everybody in here should be an exceptional hand washer.
So you can't even wear a ring when you want to work?
No. Why would you I wouldn't even wear a ring when I'm working.
How many still on the middle school?
Take that with you guys. This is like the
How am I going to take my bag out?
You follow those instructions, Mom? That's a guaranteed $100. Guaranteed. That's a guaranteed $100. So guys, just to go over it real quick, just some key points I want to point out, guys. Remove any jewelry